Are you in nursing school and you feel like that you're not learning anything, or you feel like, yeah, you get it, but it's like you can't really apply the information? It's really not sticking and you're not feeling like you're thinking like a nurse? The key to nursing school is to really understand critical thinking. I'm going to help you all with some quick tips. Hi everyone, I'm your fave Nurse B. I want to talk about critical thinking in this video. It's so important when it comes to nursing because you can't just memorize things in nursing school and think that you're going to be able to get through it, be okay, be a great, awesome nurse. You have to start applying it to an actual patient, into the actual clinical setting, and you actually need to start thinking versus just regurgitating whatever it is that you read or that you study. So the number one thing that I want you all to do, and it's super simple, is to ask why. Ask why. So say for instance you come across a disease. You're in med surg, you come across hypertension. We all know high blood pressure. Okay. Look at the signs and symptoms of high blood pressure. One of them could be dizziness or headaches. Okay, you memorize that. Okay, headaches or dizziness is a sign and symptom of hypertension. But what exactly, why is it a sign and symptom? Why? What's actually causing this patient to have these headaches? Because a lot of people say I'm just having headaches. And that's why hypertension sometimes is underdetected, because, I mean, headaches can come from anything. But why specifically with this disease is my patient having a headache? What is happening pathophysiologically or patho-wise that's causing the patient to have a headache? Once you start asking the question why, you get deeper and deeper into that disease, or deeper into the different drugs that you're going over, whatever it is that you're looking at, you go deeper into it. And that's the whole thing with critical thinking, is that you can't just take anything at surface value. You have to go lower. I mean, you have to go deeper. You have to go into the depths, the core of the problem, the core of the question, and ask why every single time. So what you can do is you can create a concept map. You can put signs and symptoms of hypertension, go over each sign and symptom, and underneath that go even deeper and ask the question, why is this a sign and symptom? If you're looking through the patho and you can't figure out why, ask your teachers, talk to them and say, what is causing them to have hypertension? Is it because there's so much pressure on the blood vessels and that's causing them to have these headaches? Is it because it's like a rush of blood to the head? Is that causing the headaches? Is it because the capillaries and vessels in the brain is so small, and so when they're pushing against it, it's causing so much pressure and it's hurting the person's head? What is causing these headaches in a patient? You know, once you start thinking like that, it's just like the light bulb just turns on, and it just shifts your way of looking at things when you go deeper. I know in nursing school so much stuff is being thrown at you and crammed your way, but you will be able to learn so much more, and you'll be able to help your patients better when you can see things on a deeper level. And I know I keep saying deeper and critical and think, but it's so true. Ask the question why, and that's simply what you must do to start thinking critically. Now, you can then take what you've learned and ask the questions why, go through that, and then apply it to something. That's why we have certain things like case studies in nursing school, and I think that's very important to do case studies. If your teacher does not provide them, just look up case studies for patients with high blood pressure, whatever, and it'll give you a scenario of a patient. It'll ask you like certain things that you should do for the patient, or why did the doctor order this, and it just makes you start questioning things. You have to always question things, because that's exactly what's going to happen in a clinical setting. A patient's going to come to you and say, oh, I've been falling a lot. I don't know why I've been falling. You can ask them questions. You have to start asking them questions. Have you changed your medications? Have you lost any weight lately? What happens before you fall? How do you feel before you fall? Do you fall at a certain time during the day? Are you drinking enough fluids? What have you been eating throughout the day? Do you drink alcohol? Do you smoke? You want to ask these questions because all those little components make up this big picture of what could be causing your patient to fall. Okay, in nursing, we need to look at the big picture as well as the detail. We need to look at the patient as a whole, holistic care, them, their family, all that jazz. Look at their whole workup, head to toe assessment. But we got to go deeper. We got to ask questions. We got to see what could be causing this, okay? And that's why I say this is critical thinking is good in school, but it's also very, very important into a clinical setting. Because a patient comes in and say, I'm falling all the time, and this patient is elderly, you just say, okay, she's old, she's just falling. But that's not always the case. We need to go deeper, because you can just write off a whole list of things and be like, oh no, she's just old and she's weak and her bones are brittle, so that's why she's falling. But it could be a ton of other things that's happening, but you're only looking at one thing. That's why it's you gotta look at both the big picture and you gotta look at the details. You have to become like super freaking like anal about things when you start dealing with nursing school and dealing with critical thinking. And don't think that you have to get everything as soon as you look at hypertension. You got to learn everything about it. That's not the case, because you're going to probably learn about it in A&P. It's going to probably come up again in pharmacology when you're going over meds. It might come up again in it's going to come up again in med-surg. It might come up again when you're talking about maternal child because of preeclampsia. It might come up again when you're dealing with pediatrics. So it's going to come up in more than one way. You know, you're going to see it over and over again, and it's going to build layers. And each time you come across this disease, you're going to learn more about it. Okay. And you're going to ask more questions of why is this happening? Why is it different in children than it is in adults? Why are pregnant women more susceptible to it? You know, why do pregnant women have hypertension? What's really causing it? Continue to ask the questions why versus just saying, I want to remember the signs and symptoms. That's not going to help you when it comes to taking care of your patients. It's not. Signs and symptoms, yeah, you want to know that, but that's not going to make you a strong nurse to just know signs and symptoms. And I wish this was something that I really knew about while I was in nursing school. I really do, because I feel like it would have changed. I'm sorry, I'm scratching my leg. It would have changed the way that I learned. I would have been way more like, I was like a student that was like really in depth with stuff, but I feel like I would have dived even deeper into it versus just remembering signs and symptoms. So that's why I'm giving you all this information, because I want you to think deeper. And you might not get it. Like I said, you might feel overwhelmed. It might be a whole lot on you, but you might look at the key signs and symptoms and go from there. Or you might look at the treatment. Why does this treatment help the patient? You know, why is it more important for me to put a warm compress on my patient versus a cold compress on my patient? Because guess what? Your patient's going to ask you why. They're going to say, why do I keep having headaches with this when I'm taking this drug? Or why am I having headaches when I have high blood pressure? What causes that? They're going to ask you that, I'm telling you. And you want to be able to answer it. Or there might be a situation where something is happening with a family member and with your family member, and they're going to be asking you questions, and you're going to be the one they come to about it. Like, this is like real life type of things, and you want to be able to do that. You want to be able to answer those questions for your family or for patients. And the key comes into asking why while you're in nursing school, while you're in that safe environment, learning environment, and challenge your instructors. When you're in your study groups, ask each other why. Why do you think this is the case? Why do you think this is causing this? Why do you think we should do this instead of doing this first? Start just allowing yourself to really dive deep and really explore. That's like the beauty of nursing, the beauty of healthcare. That's why I think that science and math is so heavy. Of course, you need that to navigate through it, but science and math really makes you start to think critically, and you should start seeing it like that, like it's a challenge, like it's a puzzle. And you should start seeing, like, I don't know, like it's kind of fun to really figure out what's causing these issues in a patient, to really start understanding what is happening in a human body and why is it happening. Why is it that high sodium diets are contraindicated with a patient who has high blood pressure? Why? What exactly is happening on a cellular level to this patient when they consume too much salt? What's causing them to have more issues with their high blood pressure? You want to know, you all. It's just so important to dive deep. Okay, so I want you all to think about that and to ask each other the questions why. Ask your instructors, ask yourself, and see it. I guess, I mean, the nerdy part of me is like, see it as a game, but it's kind of like that. That's why they say practicing medicine. You know, we're not doctors, but that's pretty much what it is. Like, we're practicing this. We're learning every single day. We're supposed to be learning something new and thinking differently and adding on to our knowledge. So just keep that in mind when you're in school. You're adding on to your knowledge, okay? You don't have to know everything the first time you see it, but there's certain things that you need to get, little nuggets of information that you need to get. When you have a patient who has, when you're in clinicals and you're talking to a patient or something like that, ask them, you know, how did you know that you may have had diabetes? Like, what was some things that was going on? And then they'll start telling you their story. They'll start saying, oh, well, first I was peeing a lot and I was doing this. And, you know, something told me to go to the doctor. You will remember what that patient told you probably way before you remember what you read in a book. And that patient is probably going to tell you all the signs and symptoms that was in that book. But since you kind of applied it to an actual human being and it became like a narrative to you, then it might be easier for you to understand it and remember it. And that could be the case with learning stuff in nursing school. And I got this, oh my goodness, I forgot who sent it to me. I'm feeling so bad, but I remember someone, I don't know if I saw it, I forgot where I saw it at. I don't know if someone DM'd me or emailed me or I saw it in the Facebook group. I cannot remember and I feel so bad about it. But shout out to you. Somebody was saying that they made the signs and symptoms, or they made like certain things into stories so they can remember it. And that is so freaking smart. And that's even how people, I was looking at this documentary about the mind, and it was saying people who are like masters at remembering like freaking like 200 numbers, like just by looking at it, they remember them like right off the bat, is because they start to form stories in their mind and they start seeing numbers as like symbols, and they start like they instead of remembering the number, they remember the symbol because it's easier for us to remember like photographs, and they will see that and they will translate that into a number. And I think that's like amazing. But anywho, it's on Netflix. It's like something Mastering the Mind or The Mystery of the Mind. Anywho. And so if you can translate words into an actual story or into some type of vision that you're seeing, like, I'll come up with some, but I think it's like phonetics or I'll put it on here. But people start taking the words and make it into something that's more human-like. You know, we remember a story that someone told us because we'll start picturing this guy walking into a grocery store and he looks over, he sees a lady with a yellow vest on. And this lady has this really horrible face and she's looking crazy at him, but she offers him to taste this apple that she has. And, you know, you remember that before you remember like this huge paragraph of words, right? So maybe you can take certain signs and symptoms and turn it into a story. You can say, you know, Billy was going to school and he had to pee all the time. He was so afraid. He had to just pee all day long. And he was just so thirsty and he had to keep peeing. He was just so thirsty and he was peeing and thirsty all day long. And he had all these headaches. And then, you know, whatever, you know, then it turns out that Billy had diabetes, whatever. So you can turn things into stories. You can make narrative from them and see if that helps you remember stuff. Make it as human as possible. Make it fit you as possible. I'm an auditory learner, so I'm more of like a traditional learner. So like reading and listening and writing, that helps me to learn. But some people, they have to actually connect it to like a real life thing. But also I learn really, really well in study groups. So talking to people, hearing people talk, that's going to add to me learning. Just having that social interaction helps me to learn. You can get with your study group and you all could come up with different little acronyms and different things. I remember we had this one called My Vest is Tight, and it was like it had to do with like airborne diseases. And each one, like, I think it was like varicella. All of them like counted to some type of airborne disease. And the reason why it was like my vest is tight, I can't breathe. That's how we remembered it, and we remembered like the different diseases, whatever. Of course, I can't remember them now off the top of my head, but things like that. You can come up with fun things to help you remember this stuff. It doesn't have to just be you reading the book, writing down stuff. Oh, okay. It doesn't have to be that dry. You can make it into something fun, and maybe I'll come up with some stuff and put it on here, or if you all have some ideas, put it on the Facebook group. Yeah, like I said, I'm an auditory learner, so I'm not necessarily 100% creative when it comes to learning stuff. I just do what fits me. You know, if I write down an acronym and it fits like me, then I'll remember it, you know, or if it's a person that I know. You can take it and you can assign different people in your life different like drugs, you know, and say, okay, my aunt such and such takes this drug, it causes this, this, and the third, and it might help you to remember it better. But talk to people, talk to your patients, create little scenarios, and always ask the questions why. That will help you to think more critically and help you to apply the knowledge and help it to stick, because you're really assigning it to something that's human. You know, we're all human besides anything, and a lot of people, they might not feel like this has anything to do with it, but the way you feel about something and your emotions to something really helps you to remember it. Emotions is super important when it comes to remembering stuff. So that's why I say if you can connect it to a patient, that might help you. Talk to that patient, ask them, you know, what was going on with it, with them when they had this disease or when they got diagnosed. Or ask them, I've had patients and I'd be like, so how was the MRI? Like, what is the MRI like, you know? And just hearing them talk about, oh, it's so loud and you gotta sit still, like, oh my goodness, it's just crazy. You remember those two things, and guess what? Those are like two patient teachings that you would have to tell your patients. Or they were like, oh yeah, I had a piercing in my nipple, I had to take it out before I went in there. Like things like that, you be like, oh okay, yeah, so you got to take that out, da, da, da. These are patient teachings, or these are things that I have to remind my patient of before they go in there. Boom, that could be a freaking NCLEX question, you know, right there. And you talk to somebody and they let you know what was going on. Y'all get what I'm saying? I hope this is making sense. It's late, I'm tired, but anywho, those are my tips for you all. I hope you all found it helpful. It's possible to learn in nursing school, but just know you're going to learn way more when you get out there in the clinical setting. And do NCLEX questions, y'all. Do them and read the rationale, okay? Read the rationale. That's like important. And do study groups. I have video about study groups. Pay attention when you're in clinicals. Ask questions. Talk to your patients. Read your patient's history. Read some of the labs and different tests that they ran on them. If you don't remember all the labs and tests, write them down. If you know your patient had a heart attack and you realize, okay, they did this test, write down those tests. Where were the labs for that patient? Look that back up. That way you can remember, okay, when a person is having a heart attack, we're going to look at the cardiac enzymes. Boom, 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 boom. Those type of things. Or what are the routine labs that they're running on this patient? Okay, the patient has a history of this, this, and the third, and we're doing routine labs every 6 months about this. Okay, so these labs are connected to this disease. Why is it connected to this disease? What are the normals? What are the, you know, what's high and what's low? What are we going to do for the patient if it's too high or if it's too low? Okay, what drugs are they on? Are they getting these tests done because they're on a certain drug? Okay, they're getting a TSH, but they don't have any sign, they don't have any diagnosis of having any type of thyroid issues. So why are they taking that? Ask questions. Ask questions. And really dive deep, you all. Like I said, look at it as a puzzle. Have fun with it. Do your study groups. Talk to people. Be social. And allow yourself to be a human and connect with the material. Connect with it, okay? I want to add this. When you keep information in a book or on a piece of paper or in your notes, it will stay there. But when you actually apply it to a human being, then you will see what's really happening with your patients, what really happens to people. Pay attention in clinicals. Look at your patient's skins. Really do those head to toe assessment. Ask them questions. Look at their nails. Look at their teeth. Look at the way they're breathing. Look at how they communicate with you. Look at the way they move their body. Look at some of the complaints that they have. Do they have pain? Or they are nauseous? Things like that. Look at those things, okay? The whole point of being a nurse is that you take this science and this information and you apply it to real human beings. So never allow yourself to just focus on, I'm reading these books, this is all I got. No, if you got people in your family who got diabetes, who got high blood pressure, who have skin issues, who have had to get triple bypass surgery, anything like that, talk to them. Ask them, what did the nurses say to you? What did the doctor say to you? What did you learn from this? Or what did you have to do before you went in? What was it like? How did you feel? Apply it to real people and you will learn. Trust me. And like I said, I wish that I had done this while I was in nursing school more and more. But when you're, especially if you're a CNA, like you're around so many patients who have these issues. Take a minute, ask a nurse, like, hey, what drugs are they on? Or do you think that anything we used to be able to look at care plans when we were nursing, when we were CNAs, and you can kind of look at their diseases. What do they have? Talk to your patients, talk to the family members. Patients want to talk about what they got going on with them all the freaking time. You know, some patients do. But really start looking at it. And really, I mean, of course you want to go by what's in the book, because patients sometimes have different symptoms than what's in the book. But still, when you come across, learn about freaking kidney disease, and you know that such and such has kidney disease, and you know that there's this big sign in the dietary that's saying they can't have anything that's in potassium, that has potassium, and they have a list of all the different things. You remember, oh, okay, boom, I gotta remember what Mr. Johnson can't have. Okay, so that means he has kidney disease. I gotta remember, okay, he cannot have spinach, orange juice, bananas, all this. Okay, boom, he has to have a low potassium diet. Okay, then you start asking the question, why? What is potassium doing? Why can't they have potassium with kidney disease? You go deeper and deeper and deeper, but at the end of the day, you applied it to a real human being, so it just sticks in your brain, you all. We learn like that. We learn through telling stories. We learn through actually having connections with other human beings. Okay, so don't be so caught up in a book that you can't actually see what's happening to a real life patient. You don't want to be that nurse. Okay, I gotta go. I love you all. Thanks for watching. Make sure you like, comment, and subscribe. Share my channel with anyone who finds it helpful, whether it be other students, teachers, your friend, your baby mama, sister, cousin, Tracy. I love you all. Peace.